Number one is Miss Indri.
Oh, Miss Indri. Okay. Oh, sorry. Number one is Miss Indri.
Yes,
Mulyasari.
Mulyasari Purbawati. Okay. Please,
Udah,
Miss Indri.
Mulyasari saja. Okay. Thank you, Mrs. Dwi Suteningsih. Is it my turn?
Yes.
Yes, okay. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
I'm sorry. Sorry for the. Sorry, I'll try to. No. I'm sorry. Try to share my screen. Yes. Okay. First of all, thank you, Widis Tuningsih, for the time, and thank you for the committee for giving me this opportunity to present my research result. Today, I will present my research entitled The Accuracy of Mid-Upper Arm Circumference to Estimate Body Mass Index in Indonesian Adults. First of all, my name is Indri Mulyasari, but this research have done with my team. They are Bapak Sugeng Marianto and Mrs. Purbawati. We are from Nutrition Department, Universitas Ngudi Waluyo, Semarang. Okay, without any further ado, I will start with the table of the contents. I arrange my presentation. First of all, I will explain the introduction, material and method. The second, third, result and discussion, conclusion, and I will close with some acknowledgement. Let me start with the introduction first. Okay, this research the idea come from the information that in clinical practice, weight and height are measured to calculate body mass index or BMI, one of the markers for malnutrition in adults. But how to obtain BMI information from a patient who cannot stand? Because BMI need to measure weight and height, which are have to measure in standing position. Many previous research recommended to estimate BMI by measuring mid-upper arm circumference. Mid-upper arm circumference has been recommended as a feasible method to identify adult malnutrition. Mid-upper arm circumference has a positive and significant correlation with BMI. Many studies have explored the prediction of BMI from mid-upper arm circumference. I took two research for the example. First, from Powell, Tuck, and Hennessy in 2003. The study recommend two equations for men and for women to estimate BMI from mid-upper arm circumference. And Brito in 2016 recommend one equation, not distinguish between men and women, just one equation, and the cutoff mid-upper arm circumference to diagnose malnutrition. But both of the research have not done in Indonesia. With the sample is not the Indonesians. So the question is it suitable for Indonesian adult? That question began this research, become the background of this research. A research on mid upper arm circumference as alternative for estimating BMI has been done by me and my team in 2018. And we presented the result research at ASEAN, or Asian Congress of Nutrition, in 2019. That's the preliminary research. But the question is the equation accurate? So this study aimed to analyze the accuracy of the equation. And we've done the research in 2019. And right now in 2021, I presented the result in ICENIS. Materials and method of this research. This research is cross-sectional study, and we did it in Kalongan Village, East Ungaran, Semarang Regency in November 2019. We use incidental sampling in 65 people, 32.3% male and 67.7% female, 20 to 50 years old, not pregnant, not fasting, do not have hand or foot injury, non-disabled person, and the subject have informed the purpose, protocol, and possible risk of the study, and written informed consent was obtained. That's for design, location, time, and the population. And the anthropometry and data analysis. The anthropometry have measured with standard protocols. Weight and height were measured in standing position. Mid upper arm circumference was measured in supine position on the left arm. For the data analysis, weight, height, and mid upper arm circumference data were expressed as mean and standard deviation. The correlation of mid upper arm circumference and BMI was determined using Spearman correlation analysis with 95% confidence of intervals. BMI was estimated for all subjects using the formulated equation from previous study. Our study with the equation BMI equal 1.113 mid upper arm circumference subtract 5.908. Wilcoxon test was used to analyze the difference between actual BMI and estimated BMI. Mean difference analysis was used to assess the tendency of under or overestimation. And here are the result and discussion of this research or study. First is the anthropometric characteristic. We can see now in the table 1, with the mean and the standard deviation is 44 plus minus 10.9, the height 140 plus minus 8.3, mid upper arm circumference 21.5 plus minus 4.02, BMI 18.31 plus minus 4.1. Dietitian often encounters a problem when carrying out nutritional assessment on patients who cannot be measured or weighed. The use of the reported weight and height from patient usually incorrect, reducing the effectiveness. So we need alternative parameters to estimate the parameters. Mid upper arm circumference is one of the simple methods that can be done in different settings. The equipment to measure mid upper arm circumference is inexpensive, and the procedure is easy to perform. Mid upper arm circumference can be measured in standing, sitting, or supine position. In this study, we measured the mid upper arm circumference in supine position. In this study, we found that mid upper arm circumference was positively correlated with body mass index with coefficient correlation 0.816 and p-value under 0.0001. In table 2, we can read the mean difference among actual BMI and estimated BMI. Actual BMI and estimated BMI, the mean difference is negative 0.28 with p-value 0.930. The result of the present study indicated that mid-upper arm circumference can be used for estimated BMI. The equation had negative 0.28 kilogram per meter mean difference of actual and estimated BMI. It is shown that the tendency of underestimate. From the result, we can conclude that mid-upper arm circumference is a parameter that correlates very well with BMI and can be used as a substitute for the situation in which the subject cannot be measured in standing position. This study result can be used as additional information of estimation equation for BMI based on mid-upper arm circumference data for Indonesian. It can be used as an alternative to obtain BMI value for Indonesian adult. The acknowledgement from the study is the author will thank the research grants LPPM Universitas Ngudi Waluyo in 2019, which has funded this research. And the authors have no conflict of interest. And this is my contacts for further information of this study. If you want to know the complete information, you can contact me by email, Instagram, ResearchGate, or the Google Scholar. Thank you. That's all for my presentation. Thank you, Mrs. Dwi Sutiningsih. The time I give it to you. I hand over to you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Miss Indri. Okay, now we'll directly answer some questions from the audience in Zoom chat. And then furthermore is the presentation of paper to be presented by Miss Juliani. Please, Miss Julie. Okay, please.
Ya, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for the opportunity, Mrs. Dwi Sutiningsih. I want to introduce myself. My name is Juliani Saningsih. My team are Mrs. Ida Wahyuni and Mrs. Ekawati. We are from Occupational Health and Safety Department, Public Health Faculty, Diponegoro University. I will present my paper, and the title is Individual Characteristic and the 5S Principle Implementation Among Smoke-First Worker Related to Musculoskeletal Disorder or MSDS Complaint. Introduction. Smoke-Free Center is one of the informal sector industries that absorb a lot of workers. However, many workers do their job without adhering 5S principle and poor of work posture. A work posture has potential to increase musculoskeletal complaint in workers. Preliminary data showed that the work tools used and the work posture were very unnatural. There were 20% of workers complain of neck, back, and leg pain after work. Workers do their job for a long period and do repetitive work. The 5S principle, according with sorting, setting in order, sign, standard design, and sustain, is an adapting principle from Japanese work culture, which stand for Seiri, Seisen, Seiso, Seketsu, and Setsuka. The principle has been recognized as being able to increase the efficiency and productivity of workers in various fields of works, both in the formal and informal sector. In addition, the workstation was also not well organized and work tools were not arranged according to work order. Therefore, the researcher intend to conduct a study to find the relationship between individual factor and the implementation of the 5S principle with MSDS complaint in small business. The aim of the study. This research aimed to analyze the association between individual characteristics such as age, period of work, and 5S principle implementation with musculoskeletal disorder complaint among smoke-free workers. Okay. This research was a quantitative study with cross-sectional approach. The population as well as the sample in the study were 141 of smoke-free workers in Demak, Central Java. MSDS complaint data collected using Nordic body map instrument, while the 5S data were obtained using a checklist. Data was analyzed using regression correlation test. The ethical clearance of this research approved by the Health Research Ethics Committee, Public Health Faculty, Diponegoro University. The data was analyzed using regression correlation. Table 1 showed the most of the age were more than 30 years old, 82.3%, and the most period of work were long working periods more than 3 years at 66%. Workers who were more than 40 years old will experience decrease of body function. And after age of 40, a human will experience a decrease in physical strength and function of body capacity. The implementation of 5S principle, the results of same question related to the implementation of sorting. The majority of smoke-free places and head-facing places, 88.3% and 89.4% have smoke-free storage places that will reduce the risk of mixing raw and finished material. The setting in order to or Saiton, 44% of places have consecutive workstation, 8.5% places have no IPA, waste channels. Sign or say so, almost all workers work without wearing special clothes. Only 7.8% of workers wash their hand after work, 12.1% workers use apron, and only 8.5% use sports shoes, even though the workplace was very muddy. Under design or seikatsu, there were 48.2% places that have closed raw material storage container, 74.5% have anti-rust work tool, and there were 84.9% work tool made of materials that absorb water. Sustainability, although the majority of workers always maintain the cleanliness of the workplace, there were still 34.5% who do not keep clean, and there were 33.8% who do not comply the workplace regulation for being safe and clean workplace. The musculoskeletal disorder complaints. The result of MSDS complaint measurement using the Nordic web map found that 3 biggest complaints of respondents were complaint of lower back pain, 40.4%, complaint of the back, 35.5%, and complaint on the right shoulder by 34.8%. Table 2, the relation between the characteristic of the respondent. However, table 2 shown that age and work period were not associated with musculoskeletal complaint. Some of the risks associated with MSDS are often the result of repetitive work, excessive workload, and incorrect work posture. And there was a relationship between the implementation of 5S and musculoskeletal complaint. The worker worked for 8 hours per day, sat in aneurysmic state, and work without personal protective equipment. The conclusion, there was no relationship between age and MSDS complaint. In addition, there was no relationship between work period and MSDS complaint. When will the implementation of 5S principle was significantly associated with MSDS complaint. Therefore, it is recommended by design a good layout and workstation to reduce musculoskeletal disorder complaint. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you very much, Bu Yuliani. You still have 5 minutes. And then next presenter, Bu Grace Wardani, please, Bu Grace. Hello, Bu Grace.
Yes, thank you very much, Bu Trisuti. I'm sorry, I will attach my PPT. Okay. Yes. Okay. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
First of all, I will introduce myself. My name is Kriswardhani Suryawati. Me and my team, Pak Farid Agus Bana and Bu Fitri Serida Mahayana. We are from Faculty of Public Health, Diponegoro University. Now I will present my research. The title is Preparedness of Health Facility to Serve COVID-19 Patients. What can be learned from Suwanda Hospital, District of Pati, Indonesia? This presentation consists of 4 sections: background, methods, result, and conclusion. As we know, COVID-19 or SARS-CoV-2 became a pandemic since the discovery of the COVID-19 cases in Wuhan, China in December 2019. Now, the pandemic has hit almost 200 countries. The mode of transmission and symptom of the disease is actually similar with the previous coronavirus, namely SARS or Severe Acute Respiratory Syndrome and MERS or Middle East Respiratory Syndrome. The case fatality rate of the 2019 novel coronavirus or COVID-19 is relatively low. Based on the data analyzed toward the number of patients and the number of deaths, it was discovered that the CFR of nCoV was less than 5% or about 4.6, but this virus has higher transmission and quickly mutates into hundreds of new variants. Yes. WHO declared COVID-19 as global pandemic since 11th March 2020, but the end of July, more than 200 countries affected by the pandemic. On 4 February 2020, Ministry of Health, Republic of Indonesia announced the declaration of novel 2019 nCoV disease that can cause outbreak and its countermeasure precision of MOH in the year 2020. President of Indonesia reported the first 2 confirmed cases of the COVID-19 infection in Indonesia. In March 30, President Joko Widodo formed the Task Force of Rapid Response to COVID-19 by Presidential Decree number 9, year 2020, concerning the designation of non-natural disaster coronavirus diseases as national disaster. And day by day, month by month, the cases confirmed. The total number of positive cases, the total number of people, positive patients were still in care and undergoing increase. And of course, the number of deaths. But at the same time, the number of recovered patients was also increased. Yes. The number of sufferers, the number who receive, and the number who death occurs in a fluctuating manner, but the tendency is increase. The pandemic that has going on for more than 1 year certainly has had a major health, economic, and social impact. COVID-19 pandemic also takes the life of medical or health personnel who died in the line of duty. It was recorded that from March to the end of December 2020, there were 504 medical and health personnel who died from COVID-19. They consist doctors, dentists, nurses, midwives, pharmacists, and laboratory analysts. Health service facility are the gatekeeper to serve COVID-19 patients, and the hospital as a referral service from primary health care face many problems due to unpreparedness to face the pandemic. And this research have the method. This study aims to analyze the preparedness of Suwondo Hospital in Pati Regency, Central Java Province, in providing healthcare service to COVID-19 patients in terms of policy to handling COVID-19 services, human resources, infrastructures, and supporting activities. This research used qualitative method, and the data was collected in May until August 2020 by conducting in-depth interview to hospital managers and staff related to handling COVID-19 patients. The data was analyzed using the content analysis methods. And what about the result? Hospitals bear a great duty and responsible to suppression of COVID-19 as well as to protect their medical and other personnel within their hospital setting. Suwondo Hospital is a type B hospital and a local government-owned hospital in Pati Regency. Because of many reasons of the pandemic situation like limitation of human mobilization, hospital utilization both ambulatory and inpatient, we name it bed occupancy rate or BOR, decreased until 14% in Indonesia. This situation, of course, gave the big impact to hospital management. And Suwondo Hospital is a referral hospital for COVID-19 health service in Pati Regency and the neighboring regions. And what about this hospital should also improve its caution and alertness toward COVID-19 transmission. Yeah. First, about the policy. According to Ministry of Health, Republic of Indonesia, stipulate COVID-19 virus as an outbreak or extraordinary accident by means of the Ministry of Health decree, and then based of circular letter of Directorate General of Disease and Prevention and Control of Ministry of Health, and also concerning the third revision, this is the third revision of guidelines on coronavirus disease prevention and control. And then provincial health office, district or city health office, sub-district health center or puskesmas, and referral hospitals should improve their preparedness and caution toward COVID-19 transmission. And of course, according to this regulation, the Suwondo Hospital requires critical preparedness to serve COVID-19 and non-COVID-19 patients too by effectively utilizing various resources such as human resources, means or equipments, method, and technology, as well as communication and coordination with the local government by means of Pati Regency Health Office and other stakeholders related to COVID-19 pandemic. In April 2020, Director of Suwondo Hospital formed a COVID-19 task force, and the director policy is the COVID-19 patient handling mechanism in the hospital is conducted by maximizing service standard due to Ministry of Health and Medical or Health Profession Association's guideline. And what about the duties of hospital COVID-19 task force? First, coordination, communication, and actuating the teams that consist of medical specialists, general practitioners, nurse, midwives, pharmacists, public relation marketing officer, administration officer, finance officer, and infection prevention and control committee or IPCC. Second, setting services procedure for the COVID-19 and non-COVID-19 patient with ambulatory and inpatient services. And then setting the COVID-19 services area zoning, and of course, PPA, personal protective equipment zoning in the hospital. And then conducting meetings to discuss and implement the new guidance of COVID-19 patient services and other related guidance. Setting some standard operating procedure or SOP due to COVID-19 patient services. And then formulating clinical practice guidance or clinical practice guideline and COVID-19 clinical pathway. Preventing transmission of virus from the patient to the employees and the non-COVID-19 patient by some activities. And the last one is give the report and recommendation to the director to face the problem that need director authorities. And what about human resources? They develop the description of COVID-19 services team, doctor, nurses, and supporting staffs, and conducting monitoring the work burden. Medical personnel in hospital are at the highest risk of being infected with COVID-19. Therefore, it is very important to fulfill PPE and their needs like food supplements, vitamin, and so on. And the last one, setting the remuneration due to increase their workload and risk of their job. And the infrastructures, the hospital should prepare all of the infrastructures to support COVID-19 patients. First, Swansea Hospital has operated biomolecular laboratory. The laboratory will test swab specimen using RT-PCR method to diagnose COVID-19 with daily test capacity of 180 specimens per day, and increase the capacity of the patient isolation rooms, emergency room, emergency services, and ICU rooms for COVID-19 patients. Routinely carried out disinfectant and the adequacy of PPE. Routinely carried out efforts to meet the needs of inpatients, ICU rooms, and emergency services for COVID-19 patients. Evaluating the stock of medicines and means or equipment on the COVID-19 patients and on the medical personnel. And last but not least, the supporting services. As our course hospital director routinely have communication and coordination to the district leader, region of Pati, and other stakeholders in district of Pati to solve the problem of COVID-19 pandemic. The donation from many philanthropies, from private sector and community, and from the government help the hospital to face the pandemic. The donation is in natural, not money, like masker, hand sanitizer, meals, vitamins, suggesting the existence of financial administration and management regulation related to COVID-19 health services and perform monitoring periodically. And then evaluated the problem that caused the delay of payment of the claim of COVID-19 patients by the government, and also reviewing claim dispute and finding the solution. As the final chapter of our presentation is conclusion. So the hospital has been carried out various activities to anticipate the COVID-19 pandemic in accordance with government regulations and implementation guidelines. The activities are establishing COVID-19 task force, setting services procedure for COVID-19 and non-COVID-19 patient, preparing isolation room for COVID-19 patient, formulating clinical practice guidelines, setting zoning for PPA, prevent transmission of virus from the patient and the employee, coordination to settlement of claim of COVID-19 payment by Ministry of Health, evaluating the stock of medicine and means or equipments for COVID-19 patients, and receiving donation from government, private sector, and community. Because the pandemic is still ongoing, Suwon Hospital is expected to continue these efforts by making improvement accordingly, finding solution of the problem. I think that's enough my presentation. Thank you, and I'm sorry I didn't attach the background because this media not suitable with my Zoom in my laptop. Thank you very much, Bu Dwi Sutiningsih. Time is yours. Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Miss Kriswardani. Okay, you can answer the question in the room chat. Maybe is other. And then next presenter, Rifa Mustika. Are you present? Rifa Mustika. Miss Rifa Mustika.
Yes.
Sorry, I will stop my share. Thank you.
I'm sorry, Miss Dwi, it's my time.
Yes, Miss Rifa Mustika. It's
Okay,
your time.
thank you.
Yes.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And thank you, Miss Dwi Sutiningsih, for my opportunity to myself for presentation my study in this time. I will introduce myself and my team. My name is Rifa Mustika, and my team is Dia Kartika Wening, Sugeng Marianto, Gala Septia Pontang. We from Ngudaluyo University at Nutritional Program Study, Faculty of Health. The title of my study is the effect of yellow pumpkin cookies, Cucurbita mossata, on the levels of 2-hour postprandial blood glucose. Cookies are generally made from wheat flour, that provides high energy but low in fiber. Wet flour can be substituted with yellow pumpkin flour to make cookies. Yellow pumpkin is a local food, and yellow pumpkin contain high beta carotene and high fiber. The previous research show that yellow pumpkin cookies with mocha flour contain low energy but high fiber. Every 40 grams yellow pumpkin cookies with mocha flour contain 91.94 kilocalorie and 8.7 gram fiber, and the content of yellow pumpkin cookies with flour contain higher calorie. The purpose of this research was to compare the yellow pumpkin and mocha flour cookies with wet flour cookies on the level of 2-hour postprandial blood glucose. Experimental study with a randomized pre-post control group design. Subject is 20 health people. The treatment group received 14 grams yellow pumpkin cookies. 40 gram yellow pumpkin cookies with mocha flour, and control group received yellow pumpkin cookies with wet flour. Data were collected by blood analyzing using easy touch glucose methods. Data analyzed by variety test. The subjects in this study were female with age range of 19 until 20 with normal nutritional status. And the research showed no different average age and BMI at a treatment group and control group. In this study, the fasting glucose levels before the treatment were respectively 86.9 in control group and 90.09 milligram per deciliter in treatment group. The 2-hour postprandial blood glucose levels after treatment were respectively 95.5 milligram per deciliter in control group and 93.27 in treatment group. The treatment of yellow pumpkin cookies with mocha flour have longer to increase 2-hour postprandial blood glucose than yellow pumpkin cookies with wet flour. Fiber content of yellow pumpkin cookies with mocha flour higher than pumpkin cookies with wet flour. I will thanks to Ngudi Waluyo University, LPPM UNW for funding this research, and this research no conflict of interest. Thank you for this time. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. You have 5 minutes, yeah, for presentation. So you can read the question maybe in the room chat and answer directly. But I think there is no question. So maybe any audience want to ask directly to the speaker? Miss Yun, please raise a hand.
Yes, Miss Kriswardani.
Okay, please.
Uh,
Your speaker is off.
what your conclusion about your research and what your suggestion? It's okay, you can answer in Bahasa Indonesia, it's okay, because all of us is Indonesian, are Indonesian. It's easy. Okay.
This research for formulation of the cookies product for local food is pumpkin yellow with tujuan awalnya gitu, for obesity community. Yeah, for obesity community with use local food.
Yeah.
Kemudian awalnya ini Bu hanya penelitian analyze nutritional content. Jadi hanya meneliti ininya saja, zat gizinya saja. Kemudian baru diterapkan ke kadar glukosa darah. Meskipun memang awalnya untuk obesitas, tapi karena memang butuh waktu yang lama gitu, jadi akhirnya ke glukosa darah postprandial terlebih dahulu.
Yes. Okay. And what's your suggestion about your research? Do you have the conclusion like the Mrs. Martini? Please look at the chat. Yes. The cookies is better to decrease the level of glucose or not? Yes. How long the cookies should give the diabetes patient? Is it
kalau untuk ke pasien diabetes belum ya Bu, hanya untuk tapi di sini memang kalau dari hasilnya memang cookies ini kan ada dua formulasi. Cookies dari labu kuning dengan tepung mocha. Suara saya masuk nggak ya? Dan cookies labu kuning dengan tepung terigu. Ya. Nah, kemudian yang lebih lama dalam meningkatkan kadar glukosa darah postprandial itu ternyata adalah cookies labu kuning dengan tepung mocha. Suara saya nggak ada ya? Oh, ada. Ibu Krisnya keluar. Ibu Krisnya keluar ya? Oh, Bu Martin, bentar ya. Saya jawab pertanyaan Bu Martin.
Please answer, Miss.
Thank you.
Yeah, directly in your chat.
Bu Dwi, Bu Martini sepertinya tidak bisa mendengar ya, karena speakernya tidak berfungsi. Jadi saya jawab dari chat saja.
Answer the question with me. Please.
Oh, ya. Iya, Bu Martini. Jadi memang penelitian ini belum ke pasien diabetes, baru ke subjek normal dengan rentang usia 19 sampai 21 tahun. Karena pertimbangannya ada pertimbangannya karena untuk penelitian klinik ini butuh sekali percobaan yang sangat panjang. Jadi memang kehati-hatian ini sebagai upaya kehati-hatian kami dalam uji coba produk kami ke manusia. Jadi kita cobakan dulu ke pasien subjek dengan IMT normal dan dia tidak terindikasi penyakit tidak menular apapun. Jadi kalau hasilnya tidak menurunkan kadar glukosa, tetapi hasil intinya adalah bahwa cookies labu kuning dengan tepung mocaf itu lebih lama meningkatkan kadar glukosa darah postprandial. Jadi lebih sedikit mungkin, bukan lebih lama, lebih sedikit sekali meningkatkan kadar glukosa darah postprandial dibandingkan cookies labu kuning dengan tepung terigu. Ya, sekian mungkin Bu Martini dan Bu Dwi.
Okay, thank you very much, Ashur. The presentation not yet, not present because not by. Bentar, belum hadir Mbak Eka, belum hadir ya Mbak Eka ya. Mbak Eka,
Iya Bu,
ini
jadi
sudah.
sebenarnya masih ada satu lagi peserta yang seharusnya datang itu kode 1969. Itu kan di jadwal presentasi pukul 14.10. Ini untuk sekarang belum ada. Jadi ada Sutrisno, Muhammad Endi Yulianto, Didi Ariwibowo, Sri Utami Handayani, dan Nisa Ayu Maulinda.
Tahu saya ada Bu Niki setelah saya, tapi kok nggak ada ya? Bu Niki Astorina, Mbak Dwi.
Bu Niki Astorina.
Ya.
Sudah banyak belum?
Belum
sesi,
sebenarnya.
setiap sesi kan hanya sekitar 6 ya kalau nggak salah.
Enggak,
ya.
tapi sebelum Bu Kris, setelah saya tuh harusnya Bu Niki Astorina.
Oh,
Saya
gitu.
hafal dari FKM.
Iya,
Saya lihat di buku abstraknya,
buku
setelah
abstrak.
saya, sebelum Bu Kris itu ada Bu Niki Astorina seharusnya. Dek Nikinya kita KL itu loh.
Iya.
Bu
Denikinya di mana ya? Mestinya ngerti ya. Karena memang buku abstrak itu kan baru dikasihkan ke kita
Oh,
sebelum
ini Bu Niki has ada
1
agenda.
hari atau 2 hari ya. Oh, Bu Niki has other agenda. Yes, she's absent today.
Berarti ya intinya
Yes,
kalau nggak
meeting.
presentasi nggak bisa ya Mbak ya? Mbak Ika ya?
Nggak bisa Bu, karena juga tidak mengumpulkan video ke kami, jadi
Oke.
tidak bisa
Nanti mungkin nggak ikut
ditampilkan.
publish di ini ya.
Tidak bisa publish ya? Tidak bisa publish.
Nggak bisa Ibu. Setahu
Tidak
saya
bisa
juga
publish ya, Mbak?
belum ada.
Ya, setahu saya peraturannya ICENIS dari dulu begitu. Barang siapa yang tidak presentasi tidak bisa publish.
Iya, saya kira itu fair ya.
Nah, monggo kalau Bu Martini tahu Bu Niki ada di mana, ini ada Bu, bisa di.
Tim.
Nah, monggo kalau enggak timnya yang presentasi, monggo Bu Martini.
Jangan sampai tidak presentasi, sayang banget.
Untuk di data kami sepertinya memang tidak jadi hadir Bu, belum ini melakukan pembayaran.
Ya sudah.
Untuk yang sudah pembayaran itu atas nama Yusi, kemudian ada juga Pak Sutrisno, tapi sampai sekarang belum ada.
Yusi,
Ya.
alumni FKM UNI.
Ya, Yusi.
Gimana Mbak? Kita tunggu aja gitu atau gimana? Saya sambil
Oh,
join di meet sebelah dulu ya.
Saya
Iya,
ikut
nggak apa-apa.
kesepakatan forum saja Ibu untuk
Ya, ini nggak saya matikan, kan? Saya pakai perangkat yang lain. Saya tak join ke sebelah dulu ini.
Ibu untuk nanti mungkin di
Sambil
akhir ada
menunggu ini
sesi
ya.
foto bersama kita.
Oh
Ya.
gitu.
Atau mungkin sekarang foto bersama dulu.
Foto bersama dulu aja.
Itu bersama dulu. Oke.
Please open your camera.
Saya minta maaf ya, sudah berkali-kali backgroundnya tidak bisa. Ini sudah latar belakang sampai polos. Sampai polos.
Oke. 1, 2, 3.
Fotonya dikirim kemana ini?
Ini masuk ke komputer kami, Bu.
Ya.
Satu kali lagi. Coba.
Kirim ke Budi Suti aja biar kita bisa dapat.
Oke.
Saya kirim ke chat room mungkin atau coba 1, 2, 3.
Ya.
Oke.
Saya biar kelihatan.
Oh, nggih. Sekedap Ibu.
Lagi.
1, 2, 3.
Ya.
Sampai bunyi cekrek.
Ya. Oke. Bu Martini will contact Diki because now she is being MC.
Tapi kalau
tapi tidak membayar, tidak membayar.
Iya,
membayar dulu Bu Kris.
Tadi yang penting Yusi, Mbak Yusi itu sayang banget.
Ya, yang penting membayar dulu karena kalau nggak bayar,
iya betul.
Ya Bu Kris, non sewu itu panitianya ketat.
Saya submit 2 kan, submit 2, saya masih ditagih yang 1, padahal saya memang sudah nggak bayar yang 1, saya alihkan ke jurnal Scopus. Hasilnya kok jadinya bagus, saya alihkan ke bagus banget gitu. Juga rasa jadi tulisan Inggris kok rumah saku apa untuk pancet begini jurnal Scopus itu. Jadi saya mundur yang 1, hanya 1 ini. Ini kan pertama kali saya ikut ICENIS. Nanti insya Allah tahun depan ikut lagi, ada Bu Yuliani kan udah langganan.
Nah, ini mudah-mudahan ini yang ICENIS ini yang E3S-nya masih ini ya, masih terindeks Scopus.
Iya, semoga.
Karena ini masih yang kalau tahun lalu iya ya, cuma yang ini kelihatannya masih di vote on oleh ini fokusnya ya, masih dalam pemeriksaan ini.
Oke, itu nego tingkat tinggi antara Pak Rektor dan
ya kelihatannya karena kemarin itu kan banyak sekali paper yang habis ini kemarin.
Andi Yulianto tuh bayar enggak? Itu tetangga saya.
Waduh, yang tahu panitia ini Mbak, yang bayar belum? Tadi sudah ada
kalau yang belum yang di warna merah ini Bu, yang saya tampilkan dan warna merah itu memang belum bayar. Nah, untuk yang Pak Sutrisno dan rekan-rekan mungkin masih ada waktu sampai pukul 14.10.
Sebentar ya, aku izin tak telepon Nyonya itu tangga sebelah Oma. Dia kan ini dari ini kan benar. Dia teknik kimia. Tekim.
Nah, ini ada Pak Budiono segala loh, padahal yang Niki Astorina ya. Kok enggak ini ya?
Padahal kan bisa di cover.
Nah, Pak Budi
ada Ekawati juga loh. Niki Astorina Yunita Budiono, Aditya Kusmawati, Ekawati itu Ekawati ada.
Kelihatannya di cover sama FKM loh Mbak. Ini yang Pak Budi yang gitu.
In spite of the COVID-19 outbreak in Wonogiri. Ikut nggak? Loh, BK malah nggak tahu. Ekawati ini loh, lihat tuh. Loh, malah nggak tahu BK-nya itu. Niki Astorina, Pak Dekan tuh, Budiono, Aditya.
Pak Budi kemarin soalnya konfirmasi itu Mbak, yang satu lagi atas nama mahasiswanya itu sudah dibayar. Nah yang ini mungkin apa beliaunya nggak tahu juga ya.
Tapi ini sudah out of date toh.
Sebenarnya kalau membayar segera bisa ini langsung presentasi nanti sore.
Nah iya, tapi kan enggak. Ini Kawati di sebelahku. Hai, tapi tidak tahu namanya dimasukkan. Judulnya aja nggak tahu.
Wah, saya tak mohon izin dulu ya, tak gabung di grup
Iya,
sebelah.
saya juga.
Nggih.
Oke. Izin live ya, sudah selesai toh izin live ya.
Ya, matur nuwun. Ya, thank you very much.
Foto di foto di screenshot untuk kamu tanya. Udah.
Ini tak gabung di sebelah dulu.
Sudah absen juga, terima kasih panitia. Izin live boleh?
Tidak apa-apa Ibu kalau sudah presentasi.
Nama Muhammad Endi Julianto. Saya apa?
Bu Dwi, sepertinya untuk Pak Sutrisno akan dipresentasikan oleh Mbak Nisa Ayu nih. Sudah hadir Mbak Nisa Ayu.
Ya, betul, Bu.
Oh iya.
Ya.
Okay, never mind. Miss Nisa Ayu. Your turn.
Okay, thank you, Miss. Wait a second. Okay, good afternoon, everyone. Let me introduce myself. My name is Nisa. And I want to present about response service methodology on the optimization culture encryption from Gandapura with UV photo detection with my team. My head team is Mr. Sutresno and friends. Hello?
Please continue.
Yes?
Please continue. Okay.
Okay. PPT-nya sudah kelihatan apa belum ya, Bu?
Not yet.
Not yet, okay. Wait.
Okay.
Waduh.
Okay, I see your PPT.
Yes. The first is let me introduction how this research is based from the analyzed World Health Organization 2018 until now. Cancer is the second leading cause of the death in the world. What about the death rate from cancer in Indonesia? Before explain this research, we must know what caused this research. This cancer cells are highly proliferative cells, so the metabolic engine can lead to produce massive system. What anti-cancer alternative that used to inhibit the proliferation mechanism of cancer cell? My research and my team is natural aspirin alternative from Gandapura calderia leaf that consists of metallic salicylate and free salicylic acid. In recent study, the aspirin metabolic salicylate induce programmed cell death in cancer cell and have some beneficial anti-cancer effect. This study was designed to increase galdolin production through UV photoextraction with addition drying agent from inactivation engine galdolin. So the limitation of inactivation and inactivated enzyme is one is quality degradation due to enzyme self-inactivation, and the second is selectivity, the operational conditions such as temperature, pH, or amount of denaturation agent. Okay. Gandapura is harvest from plants that grow well in the highland. Is located in Mount Lawu and the Dieng Wonosobo. In recent study from my teams before, so Gandapura consists of glycerin will go through hydrolysis process that use glycerin enzyme to methyl salicylate and disaccharide. From the juice, it is likely that glycerin, a highly conjugated form of salicylic acid, will cause less side effect. So, for most of the pharmacological activity, we will to encapsulated drug for functionalist liposome as drug nanocarriers for active target cancer therapy. This is the methodology of photo UV extraction. The first is pre-treatment. The leaf and the flower of the Gandapura plants were frozen using ice or liquid nitrogen. And the second is extraction. Extraction used for UV photo extractor with ethanol as the solvent and one stage osmotic dehydration for enzyme inactivation, water reduction, and glycerin extract. And the third is separation. The solid was separated from the extract using filter or centrifugation. Then added chemical or heated to remove the solvent. To obtain glycerin in solution form, the extract has been heated can be resuspended using a buffer or water. For the last is quality analyzed. Salicylic acid analysis was carried out by using the stable isotope dilution method, and the extraction results were analyzed for the glycerin content using KC for analysis. And then process of the optimization, we using Statistica for design of experiment that using namely the second factorial design method with the dependent variable and independent variable. And for the result, the effect estimation response for Gandapura extraction is the coefficient effect. The result is 1. This indicates the accuracy of the response model from the total variation in this result obtained represented in the model. For the ANOVA response, we have a lack of fit for F value, the one of glycerin level with P 0.05 is an insignificant value. For the second result is Pareto chart. For the Pareto chart, this independent variable that has the most influence in the glycerin extraction process is the percentage of ethanol concentration used. And then the observation versus predicted value, we has validation R of R squared in regression and also represent the proportional of linear covariance. And the last result, for the fit surface, the surface response of the plot show that the optimum condition at 70 minutes and the temperature of 32 degrees give 400 ppm of culturing concentration in the UV extraction process. And the conclusion is the one is coefficient of determination indicate that 100% of the variability in the response can be explained by the model. And the second is the regression model show that this model is very significant as evidenced by the F value of the Fisher test. The optimum result on the surface plot reaching more than 500 ppm are obtained at temperature between 24 until 32 degrees with extraction time between 20 until 75 minutes. That's all. Thank you for my opportunities before represented this research my team. Thank you.
Okay, thank you, Miss Nisa.
Yeah.
And make for presentation. Answer this question. The question for your Miss Nisa. Nisa, please you can read the question in from chat and directly answer.
Yes.
I think not yet.
Yeah. There's no question.
Okay, I want to ask you, Miss Nisa. Miss Nisa, you hear me?
Yeah.
Okay, I want to ask about Gandapura.
Yes.
Extraction. Okay, is Gandapura proven as anti-cancer?
Yes.
Please explain me.
From the culturing, from the metal salicylic that hydrolyzed to culturing. That's it.
Finish. What about the mechanism?
or for the mechanism. This the culturin, the enzymatic activity leading to hydrolysis of culturin to methyl salicylic acid. So the methyl salicylic acid is one of derivation aspirin. The aspirin is the most used common drug to cure cancer for pharmacology. Yes.
Bu Iin, sebentar Bu Iin. Bu Iin, sebentar. Oke. Bu Iin, halo Bu Iin. Bu Iin. Aduh Bu Iin. Non sewu, ini ada 2 meet, jadi cabang ke satunya. Nah ini, oke, sebentar ya Bu Nisa, saya gabung dulu ke sana dulu. Oke.
Iya.
Bisa lihat di chatnya dulu ya kalau ada pertanyaan. Ini sudah yang Pak Sutresno tadi Bu Nisa, kemudian 3 nggak presentasi ya Mbak ya.
Iya,
Ini
Bu.
langsung saya kirimkan ke Mbak Eka ya.
Nggih.
Ya.
Nggih. Untuk formnya mungkin bisa ditutup, Bu.
Oke. Berarti ini masih, saya pikir sudah nggak ada partisipannya. Bismillahirrahmanirrahim. Sebentar Mbak, ini saya pakai yang satu dulu. Oke, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Finally come to the end this presentation, the session. I like to thank for your all participant. Thank you for your interesting presentation. Finally, give applause for you all. Thank you very much for your attention. Thank you. Waalaikumsalam warahmatullahi wabarakatuh.
Ya,
Sorry, Pres, maaf.
warahmatullahi wabarakatuh.
Ikut acara LPPM tuh, Dek.
Iya Mbak, ini wah itu luaran 3 itu loh.